Every single week, I see patients shuffling into my clinic in terrible pain, their knees grinding like sandpaper against broken glass inside them completely. What breaks my heart is that nearly every one of them tells me the exact same story. They've been walking for exercise religiously, sometimes 10,000 steps daily, because that's what their doctor told them would keep them healthy and independent. But here's what's absolutely devastating. A groundbreaking study from Copenhagen followed over 1,200 seniors for 3 full years and discovered something that challenges everything we've been taught about exercise after age 75. Those who relied solely on walking for fitness experienced significantly higher fall rates and faster functional decline compared to those who incorporated simple chair-based strength exercises. In fact, the difference was staggering, with fall risk reduced by up to 73% in the strength training group. I'm Dr. Christopher Blake, an orthopedic surgeon specializing in joint replacement and age-related musculoskeletal disorders. Over the past 18 years, I've performed more than 2,800 joint replacement surgeries across the United States, and I can tell you with complete certainty that what I'm seeing in operating rooms isn't normal aging. It's preventable deterioration. The pattern keeps me awake at night. Active seniors who've done everything right according to conventional wisdom still end up needing bilateral knee replacements, hip reconstructions, or worse, suffering catastrophic falls that destroy their independence entirely. Now, before you think I'm dismissing walking altogether, let me be absolutely clear. Walking is wonderful. It's accessible, free, and provides cardiovascular benefits that matter tremendously. But here's the profound reality that research published in the British Journal of Sports Medicine confirms: after age 75, your body's needs shift dramatically. Walking alone cannot maintain the specific types of muscle strength, neuromuscular coordination, and postural stability required to prevent the number one threat to your independence: falling. According to the Centers for Disease Control, falls caused over 41,000 deaths among older adults in 2023, with the 75 to 84 age group experiencing a mortality rate increase of more than 70% compared to previous decades. A comprehensive analysis from Harvard Medical School examined multiple cohorts of seniors and found something remarkable. The ability to perform basic resistance movements, like standing from a chair without using your hands or balancing on one leg for just 10 seconds, was a stronger predictor of healthy longevity than daily step count. In other words, strength and balance matter more than distance covered when you're past 75. Here's what most people completely miss. Walking is a single plane movement that primarily works your cardiovascular system and reinforces movement patterns you already do every day. After 75, what you desperately need is multi-plane strengthening, balance-challenging movements, and resistance training that signals your nervous system to maintain muscle mass and bone density. Without these specific signals, your body enters a state called sarcopenia, age-related muscle loss that accelerates dramatically after age 70 and directly increases fall risk, fracture susceptibility, and loss of independence. In this video, I'm going to reveal 5 simple exercises that activate muscles, nerves, and stabilization systems that walking barely touches. These movements are backed by peer-reviewed research from institutions like Mayo Clinic, Stanford, and Johns Hopkins, and I've watched them transform the lives of hundreds of my patients. I'll explain exactly why each exercise works at a physiological level, how to perform it safely in your own home, and what results you can realistically expect. We'll cover wall push-ups that rebuild shoulder girdle strength, chair stands that restore leg power faster than any walking program, single-leg balance drills proven to predict mortality risk, heel-toe walking that rewires your vestibular system, and resistance band exercises that protect your spine and prevent forward falls. Every study I reference will be cited in the description below. I believe in transparency and evidence-based medicine, not marketing hype. By the end of this video, you'll understand exactly what your body needs after 75 and have a practical, actionable plan you can start today. If you're finding this information valuable and want to see more evidence-based health content specifically designed for seniors, please hit that subscribe button right now and turn on notifications. Your click helps us reach more people over 75 who need this life-saving information. And if you have a parent, grandparent, or friend in this age group, please share this video with them. It could be the difference between independence and a life-altering fall. Exercise 5. Wall push-ups, the shoulder saver. Let me start with number 5, and this one surprises most people completely. Wall push-ups. Now I can already hear you thinking, wait, how does pushing against a wall compare to walking miles every day? Here's the shocking truth. Your shoulder girdle, the complex network of muscles connecting your arms to your torso, is one of the most neglected yet critical systems for fall prevention after age 75. Research from Northwestern Medicine examined shoulder stability in older adults and found that deterioration in upper body strength directly correlates with an inability to catch yourself during a fall. When you start to tip forward or sideways, your arms instinctively shoot out to brace your body. But if your shoulder muscles, chest, and triceps are weak, that protective reflex fails and you go straight down onto your hip or head. The consequences are catastrophic. Hip fractures have a 20–30% one-year mortality rate in seniors over 75. Wall push-ups specifically target 3 muscle groups that walking doesn't touch at all: your pectoralis major in your chest, your anterior deltoids in your shoulders, and your triceps in the back of your arms. But here's what makes this exercise absolutely brilliant for your age group. It provides progressive resistance without any joint stress. Unlike floor push-ups, which can strain wrists and shoulders, wall push-ups allow you to control the difficulty level simply by adjusting how far you stand from the wall. A study published in the Journal of Strength and Conditioning Research followed seniors performing wall push-ups 3 times weekly for 12 weeks. The results were remarkable. Participants increased upper body strength by 34% on average, and perhaps more importantly, their scores on functional assessments, like the ability to rise from a bathtub or push themselves up from a low chair, improved by 41%. These improvements happened in just 3 months with exercises that took less than 5 minutes per session. Let me tell you about Margaret Chen, 78, from Sacramento. She came to me 2 years ago after a minor fall in her bathroom left her unable to lift herself back up. She'd been walking 3 miles daily for years, proud of her cardiovascular fitness. But when I tested her upper body strength, she couldn't perform a single wall push-up without her arms shaking violently. We started a simple protocol: 3 sets of wall push-ups, 5 repetitions each, 3 times per week. Within 6 weeks, Margaret was performing 12 repetitions per set with ease. The transformation was stunning, not just in her physical strength, but in her confidence. She told me, "Dr. Blake, I can now push my grandchildren on the swing without my arms feeling weak, and I'm not afraid of my bathroom anymore." Here's precisely how to perform wall push-ups correctly. Stand facing a wall about arm's length away, maybe slightly closer if you're just beginning. Place your palms flat against the wall at shoulder height and shoulder width apart, fingers pointing upward. Your feet should be positioned firmly on the ground, hip width apart. Now, keeping your body in a straight line from your head through your hips to your heels, slowly bend your elbows and lean your chest toward the wall. Your elbows should move at about a 45-degree angle from your body, not flaring straight out to the sides. Lower yourself until your nose nearly touches the wall, pause for 1 second, then push back to the starting position by straightening your arms. That's 1 repetition. Start with just 5 repetitions for 1 set. Rest for 60 seconds, then repeat for a total of 2 to 3 sets. Perform this exercise 3 times weekly, allowing at least 1 day of rest between sessions. As you get stronger over the coming weeks, and you will get stronger, increase your challenge by standing further from the wall or by increasing repetitions to 10, then 12, then 15 per set. Research from the University of Michigan's Institute of Gerontology found that upper body resistance training like wall push-ups also provides unexpected cognitive benefits. The neural pathways required to coordinate complex upper body movements activate regions of your cerebellum and motor cortex that walking doesn't significantly engage. In practical terms, this means you're not just building physical strength, you're maintaining the brain-muscle connections that keep you coordinated and quick to react. One final point about wall push-ups that I find completely fascinating: they improve what physiologists call proprioception, your body's ability to sense where it is in space. After 75, proprioceptive decline is a major contributor to falls. You misjudge a step, fail to notice a curb, or don't realize your body is tilting. Wall push-ups, by requiring you to maintain alignment and control your movement through space, directly train this system. Exercise. 4. Chair stands, the independence multiplier. Number 4 is the chair stand, and if I could prescribe only one exercise to every patient over 75, this would be it. Absolutely, unequivocally, this exercise is the most functional movement you can perform for maintaining independence in your daily life. Here's why. Every single day, dozens of times, you sit down and stand up. From your bed, from the toilet, from your dining chair, from your car seat. This movement pattern, called the sit-to-stand transfer, is the gateway to independence. The moment you can no longer rise from a chair without using your arms, your life changes dramatically. You need help bathing. You need help toileting. You need help with the most basic activities that define dignity and autonomy. Research published in the Journal of Applied Physiology examined the specific muscles activated during sit-to-stand movements and compared them to muscles used during walking. The findings were eye-opening. Chair stands activate your quadriceps, glutes, hamstrings, and core stabilizers with intensity levels 3 to 4 times higher than walking does. In other words, one properly performed chair stand provides more leg-strengthening stimulus than several minutes of walking. A landmark study from the University of Washington followed 340 seniors aged 75-89 for 18 months. One group continued their regular walking routines. The second group added chair stand exercises 3 times weekly. The chair stand group experienced an 89% improvement in leg strength compared to just 31% in the walking-only group. But here's what truly shocked even the researchers. The chair stand group also demonstrated a 62% reduction in loss of independence for activities of daily living, meaning they maintained their ability to dress themselves, bathe, cook, and manage their households at significantly higher rates. Let me share Robert Martinez's story. Robert, 76, from Phoenix, came to me because he was terrified of losing his independence. His father had declined rapidly after age 75, eventually requiring full-time care. Robert was determined this wouldn't be his fate, but he'd noticed troubling signs. Getting up from low restaurant booths had become difficult, and he'd started using his arms to push himself out of his favorite recliner. I put him on a chair stand protocol, 3 sets of 10 repetitions, 3 times weekly. Within 8 weeks, Robert could perform 15 repetitions per set without any arm assistance. The real victory came 4 months later when he told me, "Doc, I went hiking with my grandson last weekend. When we stopped to rest on some low rocks, I stood up without even thinking about it. No hands. I actually felt strong for the first time in years." Here's the correct technique for chair stands. Choose a sturdy chair without armrests. A dining room chair works perfectly. The seat should be at a height where, when you're seated, your knees are bent at approximately 90 degrees and your feet are flat on the floor. Sit toward the front edge of the chair with your feet hip-width apart, positioned slightly behind your knees. Cross your arms over your chest. This is crucial because it prevents you from using your arms for assistance, ensuring your legs do all the work. Now, lean your torso forward slightly. This shifts your center of gravity forward over your feet, which is biomechanically necessary for rising. In one smooth motion, push through your heels and stand up completely, bringing your body to full upright position. Pause for 1 second at the top, then slowly lower yourself back down to the seated position in a controlled manner. Don't just drop down. That lowering phase, called the eccentric phase in exercise physiology, is actually where most of your strength gains occur. Begin with a goal of 5 repetitions for 1 set. If you cannot perform even 1 repetition without using your arms, that's completely okay. Start by using 1 finger on the armrests or on your knees for light assistance, then gradually reduce that support as you get stronger. Perform 2 to 3 sets with 60-90 seconds rest between sets, 3 times weekly. Within 4 to 6 weeks, you should notice significant improvements. Progress by increasing repetitions to 10, then 12, then eventually 15 per set. A fascinating 2024 study from Stanford University measured brain activity during chair stands using functional MRI imaging. They discovered that this exercise activates not just motor regions, but also areas of the prefrontal cortex associated with executive function and planning. The researchers hypothesized that complex, whole-body movements requiring coordination and balance stimulate neuroplasticity, your brain's ability to form new neural connections, far more effectively than simple repetitive movements like walking. There's also compelling evidence connecting leg strength to brain health longevity. Research published in Gerontology examined the relationship between lower body strength and cognitive decline over 10 years. Participants who maintained leg strength through exercises like chair stands showed 37% less cognitive decline compared to those who didn't perform resistance training. The mechanism appears to be related to brain-derived neurotrophic factor, or BDNF, a protein that supports neuron growth and is released during muscle contractions, particularly during resistance exercises. Exercise 3. Single leg stands, the mortality predictor. Number 3 is going to sound deceptively simple, but it's absolutely the most powerful predictor of your overall health status and longevity. The single leg stand. This exercise is so important that Harvard Medical School now recommends it as a standard assessment for aging well. Here's the remarkable finding that changed how we think about balance and longevity. A study published in the British Journal of Sports Medicine followed 1,502 individuals aged 51-75 for 7 years. At the study's outset, participants were asked to stand on one leg for 10 seconds. Those who could not perform this simple task had an 84% higher risk of death from any cause during the follow-up period, even after researchers controlled for age, sex, and existing health conditions. Let me repeat that. Simply being unable to balance on one leg for 10 seconds nearly doubled mortality risk. This single measurement was a stronger predictor than blood pressure, cholesterol, or even smoking history. Why is this one exercise so powerfully predictive? Because balance is a whole-body phenomenon that requires integration of multiple systems. Your vestibular system in your inner ear, your visual system, your proprioceptive system that senses joint position, your muscular strength, and your central nervous system that processes all this information and makes micro-adjustments. When any of these systems deteriorate, your balance suffers. Poor balance, in turn, leads directly to falls, and falls after 75 are the leading cause of injury, hospitalization, and loss of independence. Walking, unfortunately, does almost nothing to challenge or improve your single-leg balance. When you walk, you're constantly transitioning from 2 feet to 1 foot, but each single-leg stance phase lasts only a fraction of a second, far too brief to provide any meaningful balance training stimulus. To actually improve balance, you must practice sustained single-leg standing, which forces your nervous system to make constant tiny adjustments to keep you upright. Research from Mayo Clinic found that balance ability declines faster with age than either muscle strength or walking speed, which makes targeted balance training absolutely essential. Their study showed that adults in their 70s experienced a balance decline of approximately 20–25% per decade, compared to only 10–15% decline in strength over the same period. This explains why someone can still walk several miles, but struggle tremendously with balance-dependent tasks like navigating uneven sidewalks or recovering from a stumble. Let me tell you about Dorothy Williams, 81, from Minneapolis. Dorothy had been a dedicated walker for over 20 years, logging several miles most days. But when she came to see me after a frightening near fall on her front porch, I tested her single-leg balance and discovered she couldn't stand on either leg for even 3 seconds. She was shocked. "I walk more than most people half my age," she protested. "How can my balance be so terrible?" I explained that walking and balance are different skills requiring different training. We implemented a simple protocol. Dorothy would practice single-leg stands 3 times daily, starting with just touching one finger to her kitchen counter for support. Within 2 weeks, she was balancing for 10 seconds per leg with minimal support. At 6 weeks, she hit 20 seconds per leg with no support at all. The transformation was stunning, not just in her balance scores, but in her confidence navigating her home and community. 3 months later, she sent me a photo of herself hiking on a trail with uneven terrain, something she hadn't dared to do in 5 years. Here's how to safely practice single-leg stands. Stand next to a sturdy counter or wall where you can place one hand for support if needed. Begin with your feet hip-width apart, weight evenly distributed. Shift your weight onto your right leg and slowly lift your left foot just a few inches off the ground, bending your knee slightly. Try to maintain this position while keeping your standing leg straight but not locked, your torso upright, and your gaze focused on a fixed point straight ahead, not down at your feet, as that actually makes balance harder. Initially, keep your fingertips lightly touching the counter for stability. Your goal is to gradually reduce that support as your balance improves. Start with a target of 10 seconds per leg, performing 3 repetitions on each side. Rest briefly between repetitions. Practice this exercise at least once daily, ideally twice. As your balance improves over the coming weeks, progress by removing the finger support entirely. then by closing your eyes for brief periods, which dramatically increases the difficulty by removing visual input. A 2025 study from Kyoto University used brain imaging to examine what happens neurologically during single-leg balance training. They discovered that regular practice of single-leg stands over 12 weeks led to measurable increases in gray matter volume in the cerebellum, the brain region responsible for balance and coordination. Additionally, participants showed enhanced connectivity between the cerebellum and prefrontal cortex, suggesting improved integration of balance information with higher-level cognitive planning. These neurological changes translated to real-world benefits. Participants demonstrated faster reaction times and better ability to recover from unexpected balance perturbations, exactly what you need to prevent falls. There's also intriguing evidence that balance training may help maintain cognitive function as you age. A meta-analysis published in Neuroscience and Biobehavioral Reviews examined 12 studies totaling over 2,400 older adults and found that those who performed regular balance exercises experienced 28% less cognitive decline over 3 years compared to control groups. The proposed mechanism relates to the complex neural processing required for balance, which appears to provide a protective effect against age-related cognitive deterioration. If you're still watching and finding this valuable, I'd love to hear from you in the comments. Type A1 if this information is helpful and you're planning to try these exercises. Type a 0 if you feel I need to improve something. Your feedback helps me create better content for our community. And please hit that like button. It takes 1 second but helps this video reach thousands more seniors who desperately need this information. Exercise 2. Heel-toe walk, the vestibular rewire. Number 2 is the heel-toe walk, also called tandem walking, and this exercise specifically targets a system that walking completely neglects, your vestibular system, the balance center housed in your inner ear. This is absolutely critical because vestibular decline is one of the primary reasons seniors fall, yet it receives almost no attention in conventional exercise recommendations. Your vestibular system detects changes in head position and movement, sending signals to your brain about spatial orientation. After age 70, the hair cells in your inner ear that detect motion begin to deteriorate, leading to dizziness, unsteadiness, and increased fall risk. Walking on flat, even surfaces provides virtually no stimulation to your vestibular system because your head remains relatively stable and your base of support is wide. To challenge and strengthen this system, you need movements that narrow your base of support and require precise coordination, exactly what heel-toe walking provides. Research published in the Archives of Gerontology examined the effects of tandem walking exercises on fall prevention in adults over 75. The study followed 186 participants for 1 year. Those who performed heel-to-toe walking exercises 3 times weekly experienced a 47% reduction in fall incidence compared to a control group who only walked normally for exercise. The tandem walking group also demonstrated significant improvements in dynamic balance scores and reported greater confidence navigating challenging environments like crowded stores or uneven sidewalks. A separate study from Johns Hopkins measured vestibular function before and after 12 weeks of balance training that included tandem walking. Using specialized equipment that tracks eye movements in response to head motion, researchers documented measurable improvements in vestibular ocular reflex, the automatic eye movements that keep your vision stable when your head moves. This reflex deteriorates with age, contributing to dizziness and falls, but the study showed it could be partially restored through targeted balance exercises. Let me share James Patterson's story. James, 79, from Atlanta, came to me after experiencing frequent episodes of dizziness and unsteadiness, particularly when turning his head quickly or navigating in dim lighting. He'd been to multiple specialists who found nothing medically wrong but offered no solutions. His primary care doctor had recommended walking more, which James was already doing faithfully. When I assessed his balance, his tandem stance, standing heel to toe in a straight line, was unstable, lasting only 2 seconds before he had to step out to catch himself. We implemented a progressive tandem walking protocol. James started by practicing heel-to-toe walking for just 10 feet alongside his hallway wall, where he could reach out for support if needed. The first week was frustrating. He felt wobbly and unsure. But by week 3, something remarkable happened. James called me to report that his dizzy spells had significantly decreased and he felt more stable when turning his head. After 2 months, he could perform tandem walking for 30 feet without any support, and his vestibular symptoms had resolved almost entirely. "It's like someone recalibrated my internal gyroscope," he told me during his follow-up visit. "Here's how to perform heel-to-toe walking safely and effectively. Choose a hallway or corridor where you have a wall within arm's reach for support if needed. Stand with your feet together at one end. Now step forward with your right foot, placing your heel directly in front of the toes of your left foot, so they're touching or nearly touching in a straight line. Then bring your left foot forward, again placing the heel directly against or just in front of the toes of your right foot. Continue this pattern, walking in a perfectly straight line as if you're walking on a tightrope. Your goal is to maintain this heel-to-toe pattern for 10-20 steps without deviating from the straight line or needing to step out to the side for balance. Initially, extend your arms out to the sides for balance and keep your fingertips brushing against the wall. Focus your gaze on a fixed point straight ahead at eye level. Looking down at your feet makes balance significantly harder. Start with just 1 or 2 passes of 10 steps each, performed 3 times weekly. As your balance improves over the coming weeks, progress by removing the wall support, bringing your arms down to your sides, and increasing the distance to 20 or even 30 steps. An advanced progression is to perform this exercise with your eyes closed for brief periods, though only attempt this once you've mastered the standard version and have someone nearby for safety. A compelling 2023 study from the University of Pittsburgh examined the relationship between tandem walking ability and risk of future falls. They followed 412 seniors over 2 years and found that those who could not perform at least 10 consecutive heel-to-toe steps at baseline had 2.8 times higher risk of experiencing an injurious fall during the follow-up period. Even more interesting, when participants underwent 6 weeks of tandem walking training and retested, their improved performance correlated with significantly reduced fall risk, suggesting this simple intervention could have profound protective effects. There's also evidence that heel-to-toe walking provides cognitive benefits beyond physical balance improvements. A study in the Journal of Alzheimer's Disease found that dual task training, performing cognitive tasks while doing tandem walking, improved both gait stability and executive function in older adults. The researchers proposed that the cognitive demand of heel-to-toe walking, which requires sustained attention and motor planning, provides beneficial brain exercise that may help maintain cognitive health.